Middle East Respiratory Syndrome, MERS, is a viral respiratory illness caused by the MERS-CoV, Middle East Respiratory Syndrome coronavirus. MERS was first identified in September 2012 in Saudi Arabia, when a man presented with severe respiratory illness and ultimately passed away due to the infection. Genetic analyses of the virus revealed that it was a novel coronavirus, distinct from the previously known coronaviruses such as SARS, severe acute respiratory syndrome. Since its discovery, MERS has caused outbreaks in several countries, with most cases linked to travel to or residence in the Arabian Peninsula. MERS, Middle East Respiratory Syndrome, is caused by the MERS-CoV, Middle East Respiratory Syndrome coronavirus. The primary route of transmission for MERS is through close contact with infected individuals, particularly through respiratory droplets produced when an infected person coughs or sneezes. The virus can spread between people in healthcare settings, within households, or when people have close contact with infected camels. Camels are considered a major reservoir for MERS-CoV, and the virus has been found in dromedary camels in several countries in the Middle East, Africa, and South Asia. Direct or indirect contact with infected camels is believed to be the primary source of infection for humans. This can occur through consuming raw camel milk, undercooked camel meat, or close contact with the animals, such as visiting camel markets or farms. However, the exact route of transmission from camels to humans remains unclear. Human-to-human transmission is typically limited, but outbreaks have occurred in healthcare settings where infection control measures were insufficient or not properly implemented. To reduce the risk of MERS infection, it is recommended to practice good hygiene, such as regular hand washing, avoiding contact with sick individuals, and taking precautions when visiting areas with known MERS cases or camels. Healthcare workers should follow strict infection control measures to prevent the spread of the virus in medical settings. Middle East Respiratory Syndrome, MERS, is a viral respiratory illness caused by the MERS-CoV, Middle East Respiratory Syndrome coronavirus. Symptoms of MERS can range from mild to severe and may include fever. A high body temperature is often one of the first symptoms of MERS. Cough. A persistent and sometimes severe cough is a common symptom. Shortness of breath. Infected individuals may experience difficulty breathing, which can worsen as the illness progresses. Sore throat. Some people with MERS may develop a sore throat early in the course of the illness. Muscle pain. Muscle aches and pains can occur as the body responds to the infection. Chills. Chills and shivering may be experienced as part of the body's immune response. Headache. Some individuals may experience headaches during the course of the infection. Gastrointestinal symptoms. Nausea, vomiting, and diarrhea have been reported in some MERS cases, although these symptoms are less common. In severe cases, MERS can progress to pneumonia, respiratory failure, and organ dysfunction, such as acute kidney injury or septic shock. People with underlying health conditions, older adults, and those with weakened immune systems are at a higher risk of developing severe complications from MERS. It is important to note that some individuals infected with MERS-CoV may exhibit mild symptoms or remain asymptomatic. However, they can still transmit the virus to others. If you suspect you have been exposed to MERS or are experiencing symptoms, it is essential to seek medical care promptly and follow public health guidelines to prevent the spread of the virus. As of now, there is no specific antiviral treatment for Middle East Respiratory Syndrome, MERS, caused by the MERS-CoV, Middle East Respiratory Syndrome coronavirus. Treatment primarily focuses on providing supportive care to manage and relieve symptoms, as well as prevent complications. This may include oxygen therapy. Supplemental oxygen may be provided to patients experiencing difficulty breathing or low blood oxygen levels. Fluid management. Ensuring adequate hydration through intravenous fluids is essential, particularly in cases where patients experience vomiting or diarrhea. Pain and fever management. Over-the-counter medications such as acetaminophen or ibuprofen can help alleviate fever, pain, and discomfort. Antibiotics. Although antibiotics are not effective against viral infections like MERS, they may be prescribed if a secondary bacterial infection is suspected or confirmed. Mechanical ventilation. In severe cases where patients have difficulty breathing or suffer from respiratory failure, Mechanical ventilation may be required to support breathing. Extracorporeal membrane oxygenation, ECMO, in critical cases where mechanical ventilation is insufficient to maintain adequate oxygenation. ECMO may be used as a last resort to provide temporary support for the heart and lungs. Supportive care for organ dysfunction. If patients experience organ failure, such as acute kidney injury, additional supportive care and treatments like dialysis may be required. Infection control measures. In healthcare settings, strict infection control measures are implemented to prevent the spread of the virus to other patients, staff, and visitors. It is important to note that the treatment approach for each MERS patient may vary depending on the severity of their symptoms and any underlying health conditions. Research is ongoing to develop effective antiviral medications and vaccines for MERS-CoV, but as of now, supportive care remains the primary treatment strategy.